Long before pharmacies, hospitals, or modern science, prehistoric humans faced the same medical challenges we do today. Injuries, infections, parasites, and pain were a constant part of life. Without modern diagnostic tools, how did our early ancestors treat illness and heal wounds? Evidence shows that prehistoric medicine was surprisingly practical, drawing heavily on nature, trial and error, and social care. Thousands of years ago, survival depended on a deep understanding of the local ecosystem. Prehistoric people observed animals, tested plants, and passed down knowledge across generations. Plants were among the earliest and most effective remedies. Trees like the willow contained salicin, a natural compound similar to modern aspirin, which helped relieve pain and fever. Wild chamomile and yarrow were harvested to soothe digestive issues and reduce inflammation. Neanderthal remains discovered in Shanidar Cave in Iraq show traces of plant pollen near burial sites, including species known for medicinal properties like ephedra and marshmallow root. While some debated whether these plants were part of a ritual or medicine, fossilized dental plaque on Neanderthal teeth offers clearer proof. Microscopic analysis reveals traces of poplars, bitter herbs, and even penicillium mold, suggesting early humans knowingly consumed natural remedies and antibacterial substances. Painful tooth decay and gum disease were common, especially as diets shifted. To cope, early humans chewed on astringent bark and medicinal roots to numb oral pain and clean their teeth. Clay and charcoal were also essential parts of the prehistoric medicine cabinet. Ingesting specific clays, a practice known as geophagy, helped neutralize plant toxins and calm upset stomachs. Charcoal was used to bind to ingested poisons and stop diarrhea, while mud and clay mixtures were slathered onto skin irritations, insect bites, and burns to cool the area and block infections. Wounds and physical trauma required immediate hands-on care. Prehistoric hunters and gatherers frequently suffered cuts, fractures, and animal bites. To stop heavy bleeding, they applied cobwebs, dried moss, or crushed leaves directly to wounds, helping blood to clot. Cleanliness was maintained by washing injuries in freshwater springs, and tree resin was used as a natural adhesive and seal to keep dirt out of open sores. For broken bones, early humans created crude splints using sturdy sticks, animal hides, and plant fibers. Fossil evidence reveals many healed fractures, proving that injured individuals were kept still and cared for during the weeks required for bones to fuse. Surgical procedures were also practiced, surprisingly early in human history. Trepanation, the act of drilling or scraping a hole into the skull, is one of the oldest known surgical techniques. Archaeological finds show skull bones with smooth, healed edges around these holes, proving that many patients survived the procedure. Researchers believe trepanation was used to relieve pressure caused by head trauma, severe headaches, or neurological conditions. Spiritual beliefs were deeply intertwined with physical healing. Sickness was often attributed to malevolent spirits, unbalanced energies, or broken taboos. Healers and shamans used chants, smoke, and rituals alongside physical remedies. Medicinal herbs were burned as incense, clearing airways while simultaneously driving away perceived spiritual harm. Beyond remedies, social support was the most critical medicine of all. Severely injured or elderly individuals who could no longer hunt or gather were fed, protected, and treated by their community. This compassion allowed sick individuals to recover rather than perish. Prehistoric medicine was far from primitive. It was a dynamic system built on keen observation, practical ingenuity, and human care that laid the groundwork for modern medical science.